RC701 received.
In Melbourne, paramedics Nat and Leonard are responding to a Code 1 emergency.
So we actually need to turn around.
Turn around?
So best is to get onto the tram lines. Nicely done. Okay, so what we know is we're going to an 81-year-old female. All it says is she's on the bed, she's not answering, and she was complaining of a headache. You're clear left.
Unconscious patient, elderly female, headache. The first thing that comes to mind is a stroke. Every second has huge implications on their quality of life and may even be the difference between life and death.
So if this is a genuine stroke, we can think about calling the stroke truck.
Yeah, absolutely. And they have a CT scanner on board.
They do.
And might only save a few minutes, but every minute
Clear left.
that brain doesn't have oxygen or blood makes a huge difference.
But suddenly, the emergency shifts up a gear. The call is now a priority 0. Someone's life is hanging in the balance.
Give me a bit of room.
No, you're good on my side.
Stopping
all
in the
good.
middle of the road won't do anything.
Okay, so you're going round the bends?
This must be it.
Yes.
Go into there.
Everything about this response is time critical. Despite the traffic, Nat and Leonard arrive within minutes.
Let's stop here.
Priority 0 cases are the most critical cases that we attend to. These people are generally not breathing.
Robert's a 0. You're in arrest, so let's go.
Straight away, I think we have to take all the equipment into this case. My gut feel is that she's got a catastrophic bleed, and it's clear to me straight away that this is a life or death situation.
What's her name?
Jenny.
Jenny.
Stay calm, stay calm. Is she awake?
It's a busy night in Melbourne's Emergency Communications Centre.
Emergency services. Tell me exactly what's happened.
A frantic call has just come in from the outer southeastern suburbs.
Cars hit a motorbike rider and chunks came off his leg.
Yep, and is he awake?
He's awake.
And is he breathing?
He's breathing.
The air ambulance is required for a rapid response to the accident scene 60 kilometres away.
Is there any blood pouring or spurting out?
It's an open wound. A bone came off, meat came off.
Yeah, okay, just keep him still. Keep reassuring him. You're doing really well.
Oh, just clear left.
He's right lifting.
Flight paramedic Ray is on board. He already knows the injured motorcyclist is in a bad way.
So we've been sent to a 21-year-old motorcyclist who's come off his bike at high speed. There's first ambulance crew on scene there saying he's got a compound fracture, so quite a large open fracture of one of his legs.
So I'm just going to go straight in from here. We're on finals now.
The helicopter has been cleared for landing at a local oval near the accident site.
So there's goalposts at either end. It looks like it's cricket pitch in the middle with no fencing around it.
Mobile Intensive Care Ambulance paramedics, also known as MICA, were first on the scene. They've now transported Josh, the 21-year-old motorcyclist, to meet the air ambulance.
Nothing really good comes out of a motorbike v car, and it's generally not very good for the motorcyclist.
Good evening all. I'm Ray.
Sean, this is Josh.
G'day, Josh.
Inside the ambulance, Josh is in quite a bit of pain and quite distressed. Now I'm just looking at him going, what are your injuries?
It's a bit cold, okay? Just a stethoscope on your chest. Just some deep breaths for me.
Josh can't be airlifted to a trauma centre until he's stabilised. So Ray gets an update on the patient's injuries.
Black eye, as you can see there.
Yeah.
No other bruising or hematomas that I can see. He's had no vomiting or anything.
Okay, all right. You sore in the tummy?
No.
Nothing? Hips?
No. Sorry, mate. I'm just going to expose you for a second. He's got a compound injury to his knee.
Yeah, we might put a bigger bandage on it. Okay, we're just going to cover it and moisten it. That's all we're going to do.
So this knee's borne the brunt of the impact. I could see right through into his joint.
How comfortable are you, pain-wise?
So much pain.
Yeah, no, that's fine.
It's in a bad condition. You want more morphine drawn up?
Yeah.
Josh is in extreme pain at this point in time. If he could rate it out of 10, he would be a 10.
To relieve Josh's intense pain, he's given another dose of morphine.
Car try to beat you?
Yeah, right in the back of it.
Okay, I'm going to move your arm.
He didn't indicate
right.
or anything.
So you hit the back?
Yeah.
Yeah, helmet on?
Yeah.
Leathers?
Sorry, mate.
Gloves?
No.
He's wearing a helmet, fortunately, but that's all he's wearing. He wasn't wearing any leathers, he wasn't wearing any gloves. The tip of one of his fingers is amputated off. Direct consequence of when you hit the ground without gloves.
All right, so far, what I'm looking at is a pretty serious compound knee fracture, so an open knee fracture. Josh is in quite a bit of pain with that, so we'll try to get on top of that.
You know, honestly,
Some
we're
analgesia.
get amputated.
Yeah, knee?
Yeah.
I don't reckon.
You don't?
No, but you know, you're going to need to see an orthopaedic thing. Wiggle your toe for me down there.
It looks like he shattered at least his kneecap, perhaps the underlying bones in it.
Josh, see that? Ultrasound probe.
Yeah.
Okay, just lets me look in your tummy. I just want to have a quick look, see if there's any bleeding in there, and then we'll get out of here, okay? This doesn't hurt, it's just a bit cold.
We're trying to rule out that the lungs are not working properly. We're trying to rule out that you've got no bleeding around your bladder and your pelvis. If you're bleeding in the abdomen, we want to get you to a trauma centre as quick as we can.
Are we here?
Yeah, this is it. What's her name?
Jenny.
Jenny. Jenny.
Nat and Leonard have been called to an emergency at an inner-city apartment.
I've got a pulse, so it's not an arrest.
Okay.
It appears 81-year-old Jenny has suffered a massive stroke. Jim, her husband of 57 years, called for an ambulance when he couldn't wake her.
She had fixed and dilated pupils. Her pulse was slow. These are all clinical signs of a catastrophic bleed.
Still got a pulse. She's got a good pulse.
Okay.
So,
But she's not breathing. Respiratory arrest, really.
yeah.
So we realise that Jenny's not breathing properly. So most important thing is to ventilate. Could you just quickly tell us what's happened, sir? I realise there's a lot going on. Okay.
5 minutes to 8 minutes ago, came in to me, said, Jim, I've got a terrible headache.
In a desperate attempt to keep Jenny alive, Jim performed CPR until help arrived.
Has Jenny ever had a stroke before?
No.
We've got non-reactive pupils at the moment, just
Okay.
letting you know.
It quickly becomes clear that Jenny is very unwell. She has a GCS of 3, which means she is deeply unconscious, non-responsive. She appears to only have a rest rate of potentially 4.
And they seem quite agonal in nature as well.
Jenny has agonal rests. It's what we call dying breaths. I now realise we have a massive battle ahead of us.
That's some more pain relief.
All right, mate, come in, okay? He's wind up another 5.
60 kilometres southeast of Melbourne, 21-year-old Josh is in trouble after slamming his motorbike into the back of a moving car.
Okay, the right kidney looks good, as we expected.
Are you ready for...
Ray, the flight paramedic, has ruled out any internal bleeding, but he's now giving Josh even stronger pain relief for his shattered left knee.
He is now at a point where we can do things in terms of splinting that leg and taking care of it, and he's not really going to feel it.
Hands in or hands out? Your call. All right, just need one access to this arm, so this arm's going to have to hang out.
With the pain relief now kicking in, the team can carefully move Josh into the waiting helicopter.
All right, I'm happy to roll.
This injury is a significant injury. This is not a week in hospital, this is months. And, you know, the worst case scenario, is he going to end up with a prosthetic joint?
Just in the helicopter now, Josh, OK? Yeah. Good lad.
It'll be a 15-minute flight to the trauma centre at the Royal Melbourne Hospital.
Josh, you good?
Yeah.
All right, mate, up in the air soon, okay?
Yeah.
I want you to let me know if that pain starts coming back, okay?
Yeah.
All right, good man. We're in a good spot. We are good to start whenever you are, Tommy.
Great. Thank you so much.
Ray's main job now is to keep Josh as comfortable as possible.
So the concentration now, considering we're going to have to move him onto a bed, to try to get ahead of the curve in terms of where he's going to feel pain,
As soon as he starts showing us any increase, we'll deal with that, give him a little bit more, get him over, and then let the docs have a look at him.
Despite his horrific injuries, Josh has a lot to be grateful for. In the last decade, hundreds of motorcyclists have been killed on Victorian roads. Thousands more seriously injured.
Oh, gentle. Being a motorcyclist myself, I can't really say you shouldn't be on them. I love them. But you have an enormous vulnerability to what's out on the road, and you have an enormous capacity to get into trouble. All right, mate. 10 seconds, we'll be off this.
Josh is one of the lucky survivors, but he's about to find out just how serious the long-term consequences of his accident will be.
I'm looking at Josh, and he's a 21-year-old bloke, got the world ahead of him. He's got his whole life ahead of him. And now he's going to be walking around with a fake knee, at best.
So we've got Micah coming, is that right?
Nat and Leonard are still trying to stabilise 81-year-old Jenny.
Hi guys, how you going? Hi.
A Micah team and the stroke unit have now arrived to assist.
It appears to be some sort of cerebral event.
I agree with you.
Okay.
The specially trained stroke unit can provide a quicker diagnosis, allowing treatment to start faster, hopefully reducing any potential brain damage.
So at the moment, Jenny appears to be GCS 3. It appears that she has agonal resps. Initially, we had a resp rate of about 4.
Yep.
She's actually breathing up a little bit more.
So she's possibly having a neurological event.
Okay. That heart rhythm's changing completely. I can feel it. Yeah. We notice that Jenny's heart is actually starting to slow down. We're losing. Her life is in the balance here.
Jenny's husband, Jim, stands by watching in disbelief. For he and Jenny, the day started just like any other.
It had been a perfect day in the home. We'd both done the shopping.
Our heart rate's going down. Yeah. We need to get it onto the evac mat.
I drove her around to the hairdressers just around the corner, did another job myself. She arrived home looking glam.
So what we're going to do, we're going to move this bag to that side. We're going to roll her. Okay.
And she walked in and said, "Jim, I've got a splitting headache." So I lay her on the bed and I quickly got her 2 paracetamol. It was almost instantaneous. And I said, "It's Jim here, Jen. Jim. Say Jim." And she never heard the question.
Let's go, Rob. We've done everything we can on scene. It's time to load and go. Jenny needs to be in hospital receiving definitive care to have any chance of surviving. So ready, set, go. Let's go up.
I think in this job you learn very quickly to never give up hope. Things can change in an instant. They can go from good to bad and from bad to good.
Yeah.
You all right, sir?
Yep.
Yeah.
Just a bit shaken.
Of course. It's a very stressful situation.
Jenny's husband, Jim, is travelling in the ambulance to the hospital.
Jim looks calm throughout the entire scene. Deep down inside, you just know that he's an absolute mess. You know, the love of his life is critically unwell. And I just felt so bad for him. I wanted to hold his hand when I was driving. I wanted to tell him that, you know, hopefully things are going to be okay.
The Alfred Hospital is only a few minutes away. As they race to the emergency department, Nat and Micah Paramedic Tem are constantly monitoring Jenny's condition.
Oh, she's blinking.
Jennifer.
Hi, Jenny.
Jenny. Squeeze my hand. Squeeze this one. Okay, that's a girl.
Thankfully, we're just 500 metres from the Alfred Hospital. Our only goal is to get Jenny to hospital alive.
Did Jenny respond when you asked her to press her hands?
She's making a few little movements there, Jim.
Okay, we're at the Alfred, Jenny. We're going to wheel you in. Okay, sweetie?
Both Jenny and I have a fairly strong religious belief. faith went through my mind. Faith and hope.
There's going to be lots of people around you, okay? All taking care of you, love. As we wheel Jenny into the hospital, we're met by a team of doctors and we know that she's in the best place possible. And in that moment, I am just hoping for a miracle here for Jenny and Jim's sake. Straight into recess.
So where should we go? Back to Brett?
We on?
Yeah.
It's a new day, and paramedics Taz and Amanda are heading back to base after a cancelled job.
I'll direct you. I've got Melways.
You're going to direct me from the Melways?
Yeah, better than GPS.
Amanda is into technology, but Taz is old school. He's all about the street directory.
Melways is great in some situations, but for the most part, we've got a GPS, let's use it.
All right, Taz, the GPS.
Yeah.
Where am I going now?
We're still going straight on Grimshaw Street.
Everyone will have encountered at some stage where this so-called intelligent GPS has driven into the world of nonsense.
Can you do it like GPS for me?
Imagine if we start to have GPS in Australia, but in Indian voice.
Okay.
Dear Amanda, I want you to go no right, no left. I want you to keep driving straight.
Of course, anybody else doing something like that, not appropriate. But with this beautiful Indian man next to me...
You're not listening, Amanda. I want you to keep driving straight.
Doing this beautiful Indian voice, it was just hilarious.
Oh, that is so good. I love it.
Emergency services, Hospital from Northern Victoria. We've got a child locked in the vehicle there.
But the fun has come to an abrupt end with a worrying call.
Child locked in a car at a kindergarten.
Why do people still do that? Don't lock your children in cars.
Last year, there were 1,700 calls to Victoria's emergency services reporting someone locked in a vehicle. 90% of those calls were for children.
It says that she's been locked in the car for how long?
10 to 30 minutes.
30 minutes, like as if you don't know that your child's outside in the car. You're at a kindergarten, just bring her in.
People don't understand how quickly the temperature rises in a car. So if it's just seems like a mild 25-degree day outside, if that car's in the sun, within minutes that car could be 40, 50 degrees. And that child inside is sweating, becoming dehydrated, and all of a sudden everything starts to shut down.
Put yourself in a car, turn the air conditioning off, put your windows up and sit there for 10 minutes. Tell me how hot you get.
In the past 10 years, in Victoria alone, 5 children have died after being left in cars.
Is it down there, is it?
Is it orange red?
Down there?
Tension is building in the ambulance as the crew search for the right location.
It's a kindergarten.
No, that's a primary school.
That's a primary school. We're looking for a kindergarten, aren't we?
Yeah.
Oh, no. Where is it?
Emergency services.
There's a naked fella walking around the street. He's obviously not very well.
Okay.
In Melbourne's inner city, paramedics Risky and Nicola are responding to a most unusual call.
He's just gone into the cold arcade and he's a bit just sort of sitting in the bathroom now. He's obviously very frazzled.
Okay.
So in our job, I guess you never know when the next job's going to come in, whether it's straight away, whether it's in an hour's time. But this one, someone with no pants on.
You here for Mr. No Pants guy?
Just another day in ambulance.
G'day. I'm Nicola. Is Michelle here?
The paramedics find 41-year-old Rudy looking lost in a stairwell. Confirmed, no pants on.
What's happening?
Big pain under here.
Big pain?
Yeah.
Yeah, okay. How come you've got no pants on?
Yesterday I got from this all day.
Pretty quickly becomes obvious that He's confused, and looking at him, you can tell that he's got some chronic issues. His eyes are really yellow, indicating some liver failure. And he just isn't making a lot of sense, so it's difficult to work out exactly what's going on. How long have you had this pain for?
Now, maybe a week and a half.
A week and a half. Have you gone to the doctor?
No.
Do you have problems with your liver?
Yeah.
Okay, you're seeing his eyes.
Yeah.
Have you had alcohol today?
Yesterday, yes.
Yesterday, yes. Do you know what day of the week it is today, Rudy?
Saturday.
I think it's Sunday today. When the liver fails, you can get a build-up of toxins which alter the brain and can lead to confusion. And I'm thinking that that could be the case of what's going on with Rudy. I'm just concerned, Rudy, that you've got yourself here and you're not wearing any pants. It's a strange thing for you to do, to go out in public with no pants on.
Rudy, I hear you may have been at hospital recently.
Yeah, yesterday.
Yeah.
Rudy lives in the area. He's a long-time alcoholic and was picked up by paramedics Jamie and Mike just a few weeks ago.
We'll drive you up to hospital, Rudy. How does that sound? Do you want to come to hospital? They'll look after you, okay?
This is the plan, Rudy. We're going to put this around you because you're not wearing any pants. We're going to go into the ambulance, okay? We're just going to check your blood pressure, your heart rate, your sugar, all that stuff, okay?
I would like to go to walk.
You want to walk?
Tonight is an exercise.
Yeah, but you're not wearing any pants. We can't let you walk around the street with no pants on.
Okay.
Okay.
Now?
Yeah.
Yeah.
That's it. Nah.
Nice and slow, nice and slow.
That's the way. Rudy's keen to go home, but based on what we've seen so far, we know we need to do a full assessment to work out whether it's safe for him to go home or whether we need to take him to hospital first. Good job, Rudy. Doing well. Yeah, you're fast. Oh, careful. Go slow.
One step at a time.
We're just going to check your heart and your blood pressure.
Are you diabetic?
Yes.
Yeah. Do you take insulin?
Yes.
Yeah.
His heart rate is quite elevated. Tachycardic.
How is he? 138.1.
His temperature's really high, so we're starting to now suspect an infection. Okay, so we think...
Go home to pull my aunties.
Well, we'll get you something at hospital, I think. Okay? This is more than just sort of alcohol. This is a man who's quite unwell and needs to be seen at hospital. Back to St. Vincent's, Rudy. It's a kindergarten.
No, that's a primary school.
That's a primary school. We're looking for a kindergarten, aren't we?
Yeah.
A child has been reported trapped in a car, and distressed Taz and Amanda are having trouble finding the location.
Oh, no. Where is it? Oh, back that way. After you guys, though. Thanks.
The momentary confusion is over, and the team are now only minutes away.
It must be the continuation of that street that we just went down. That's the frustrating part about the GPS and why the Melways is better.
Time is a critical factor in a case like this.
This poor mum, she must be absolutely beside herself.
Anyone locked in a car is an emergency, but children can't regulate their body temperature as well as adults. So a trapped child is a priority.
I'm Taz.
I'm Shannon. How are you?
Hi, Shannon. That's Amanda.
Who's inside?
Charlotte. And there's a Rottweiler in the back, but she's friendly.
Not only is 2-year-old Charlotte in the car, but so is Minx, the family pet Rottweiler.
How long she's been locked in for, do you reckon?
20 minutes, maybe longer than that. Maybe 25.
Charlotte's mum, Shannon, is panic-stricken. With her keys in her bag, inside the car, there was nothing she could do.
I put Charlotte in the car and the car locked itself on its own. Looking around, wanting to smash the windows, just absolute panic. I can't believe I've done this.
So after chucking my tantrum and being quite verbal about how I feel about mums locking children in cars, I am absolutely eating my words. I'm feeling like the worst person. Thankfully, she doesn't know what I was saying in the car beforehand.
She's active still. I can't really see much.
Amanda does her best to assess Charlotte's condition from the outside as the team work quickly to break into the car.
She's actually quite upset. She's crying. For us, that's a really good sign because at least she's breathing.
Oh, there you go. It's open.
They're in. Oh, hello. Can I have a cuddle? Oh, okay, fair enough. She might.
There we go.
This is normal. This is good.
You want a drink?
Have some water.
Uba. Yeah, Katus?
Charlotte, do you want to go to Mummy or do you want to stay with Uncle Taz?
Do you want to go to Taz or Mummy?
If a child is inconsolable, that can be an indication that the child is in pain or that there's something else that's not quite right. So Taz and I are quite keen to do a bit of an assessment on Charlotte to make sure she's okay.
We still want to quickly check her temperature and heart rate, if that's okay with you.
But Charlotte's not the only passenger to be rescued.
Can I check on the dog?
I'm automatically thinking, oh my God, is the dog okay as well? We know that the child's fine, which is great.
How about you?
Hello. You are stunning.
She's a beautiful girl. She loves people. She's very happy to have a pat and a cuddle, and we're just happy to make sure that she was fine.
With Charlotte safely back in her arms, a very relieved Shannon knows all too well how lucky she is.
So I dropped the older one up at Kinder, walked up, put her in the car, and put my backpack in the front seat, closed the door, and it was locked.
So you didn't even leave her? Like you put your bag in the car and it just locked?
So there's something faulty now with that.
Yeah,
So
I would get that double checked, definitely. Shannon was confronted with a situation which could have been absolutely horrendous and could have definitely ended differently. However, thankfully, we're all good and Charlotte's just fine.
There you go, and look at the number we're going to get there. 150 is good. So she's within normal range. So she's 100%.
Yeah.
But before Charlotte can go home, Uncle Taz has one more surprise.
You like it?
Yeah, it's great. It's better than the first
The red one is better.
one.
Charlotte's happy.
Yeah, she's very happy.
Yeah. Happy mum.
Happy bub.
Oh yeah, power feed. I like it. I'm getting hungry again. When are you not hungry? When I sleep. Yeah, but do you wake up hungry? Yeah. Yeah. So it's just you're more tired than you are hungry. Yeah.
In the northern suburbs, Jamie and Mike are dealing with a very common paramedic problem. They're overdue for their meal break.
I think that's probably one of the hardest things of the job is you're not always guaranteed to have your meal break on time. You can go a 14-hour night shift and not get food until you're a 12th hour into the shift, and you just get so hangry and so tired, and you can't wait to sink your teeth into anything fattening.
Oh, I really want to eat my Thai food that is at Preston.
You got Thai, what'd you get?
Pad See Ew combination. Lately I've been doing the cheeky, go to the Thai food place, get two things, pretend they're not both for me. Yeah. You know, typical grown-up stuff.
But once again, food will have to wait.
Emergency services.
We have a student with a fractured left arm.
Is it an obvious deformity?
It's quite nasty. It's actually disfigured.
Okay, help's been organised for him now. Stay on the line. I'll tell you exactly what to do next.
So we're going to a 12-year-old male who has fractured his left arm post the fall.
The still hungry Mike and Jamie have now been diverted to the primary school to assess the student's fracture.
Parked behind the white car. I think staying calm in the job, it's really important. I think some people are just really good at it. Other people, you know when they're stressing. What's the little tacker's name?
Max.
Max. Ah, no dramas.
Just through this door.
Beautiful. You're essentially like a duck on water. You're paddling like crazy underneath, but you're just calm on the surface. And it's really important to be that calm because if we're stressing out, the patient's going to stress out.
And Max is one of staff.
Hello.
G'day. And this is Max.
G'day, Max. Hi, guys. Oh, what have you done, mate? What have you done to yourself? You all right? It's a bit sore, is it? Yeah. Poor thing.
Walking in to see Max and I kind of come around and have a look and, oh, his arm shouldn't be bent like that.
You were just running around in the yard, were you? Yeah.
I teach prep here.
Yeah.
So I'm lined up with my prep grade. The deputy principal said,
There you go.
Leanne's mouthing. Max is right.
Oh, no. Max's arm looks really nasty and I think he's broken a couple of bones. He's definitely done some serious damage.
Do you drink alcohol every day?
Yes, I do.
You do. Your eyes are yellow. Are they always like that?
No, my normal color is black.
Right.
Nicola and Risky have come to the aid of chronic alcoholic Rudy. They found the confused 41-year-old wandering around a shopping arcade with no pants on. They're now taking him to St Vincent's Hospital.
Where's the pain?
Up here.
Over here?
Yes.
And you've had this for how long?
6 weeks.
6 weeks.
With severe pain in his back and a history of alcohol abuse, Nicola's concerned about Rudy's liver function.
Una manada de pájaro este campeón. Yeah.
That was in Spanish, Rudy.
No, this was over here, ya around the corner.
He's switching between sort of English and Spanish without really realising. It makes it hard for me to talk to him, but it sort of shows the level of how bad his confusion is. Just about to arrive at St Vincent's. How many kids do you have, Rudy?
3.
3? Do they live in Melbourne?
Yeah, they live with the mother.
With their mother. Knowing Rudy's got kids, it's really sad to think that if he keeps going at this rate, he's so unwell that he might not be around to sort of see them grow up. Ultimately, if he doesn't turn things around, liver failure could kill him.
Nice guy, though.
Yeah, harmless.
He was sweet. Yeah. What I want to know is how he ended up with no pants on.
Wouldn't we all like to know?
I know.
Because that's...
He didn't know.
Anyway, good luck to him.
Yeah.
Nudie Rudy.
Nudie Rudy.
You're very brave, you know that? Very brave. You're braver than me. I'm a little sook. I'd be crying if I was you.
Mike and Jamie have been called out to help a 12-year-old student with a shocking fracture of his left arm.
Hey, do you want to pop your finger in there for me, champ? Good job. He's done a number on himself.
Poor Max fell over in the playground at his primary school.
Blood pressure was 113 on 72, by the way.
His mum, Leanne, is a teacher there and was immediately at her son's side.
All right, Max, what we'll do, we've got a little medication that we'll spray in your nose and hopefully it makes you feel much better, OK? How does that sound?
Very good.
Very good.
Excellent. This is just a strong painkiller. It's like a synthetic version of morphine. It won't knock him out or anything. It can make him say a few silly things, but it's a really good painkiller.
Do you want to just lean your head back just a little bit? All right, ready? 1, 2, 3. And one more. 1, 2, 3. There we go. Beautiful. It might dribble out a little bit. Just sniff it up. Fine. Lovely.
How long does it usually take for the painkiller to...
Usually pretty quick, but you've done a decent job, so it might take a little while.
With pain relief on board, the boys can now put a splint on Max's arm.
All right, so I'm gonna hold on just to your fingertips and I'm gonna take the weight of your arm here. So I'll do the very, very little moving. Oh, good. And if you can help, beautiful. Yeah.
Sorry, champ.
Very brave, Maxie.
Sorry, mate. I think that's
You
probably
are
the
a
best
champion.
spot. Look at that.
And I'm gonna hold underneath there. You're doing great.
Will I still be able to play PlayStation?
Oh, of course.
Yeah, mate. What do you play on PlayStation?
Fortnite.
Oh, nice.
Is it good?
Yeah.
I haven't played it yet.
Max is a champion. He has his priorities right. Every bloke, no matter how old we are, we like a bit of PlayStation or Xbox, so I can appreciate that. That's good position there, Jamie. You happy?
Yeah, I'm happy with that, mate. Is that okay? Yeah? Oh, beautiful. He's not choking you, is he?
No.
No, he's doing a good job. All right, mate. How are you on your feet? You okay? Do you reckon you'll be able to walk? Yeah? You all right? Beautiful. You're taller than me.
Some kids are braver than I am, I'll be honest. Like, they can be amazing and they kind of go, oh, I just want to keep playing. My arm's hanging off at a weird angle. I just want to keep playing. They're great.
I am happy to roll, mate.
Cool. Everyone's all buckled up?
Yeah.
Excellent. Very good. Off we go.
Do you play any sport, champ?
Footy.
Footy. What position do you play?
All around, sometimes on wing, sometimes in the forward,
Ah,
sometimes in
nice.
the back.
What's your favourite position?
Probably the wing.
Yeah.
And Dad's his coach.
Oh, there you go.
When I rang my husband, he goes, oh, there goes his footy career.
Nah, you'll still be able to play footy.
In a little while.
Yeah, in a little while. Yeah.
Max is starting to feel a lot happier.
Smile. Give us a thumbs up.
He'll now be taken to X-rays to find out just how bad the damage is to his deformed arm.
Yeah, good. Here we go. A few bumps as we come out. It's like a transformer, this thing, when it makes sounds.
For this 12-year-old, it could be a long, impatient wait before he can resume his footy career.
And down we flop.
Poor little Max. It might be a while before he's back playing video games or footy, but hopefully we can get together one day for a kick.
Absolute trooper.
Thank you.
5 weeks ago, Josh slammed his motorbike into a moving car. The 21-year-old was worried his left leg would be amputated.
I was conscious the whole time, so I remember hitting the car and flying in the air, and then just the impact on the ground was just like a thug.
Josh still has his leg, but it'll take months of intensive rehab to fully recover.
The damage to my left leg's pretty severe. I had like 150-something staples and stuff in it. I had 5 or 6 surgeries on it, so I had the ankle reconstruction, tibia and fibula, I think have rods in them now. I'm not too sure, but I'm pretty sure my kneecap's metal, and my femur had a rod put in it as well, and some screws and plates. And I'd broken a couple of ribs, lost my little finger, and yeah, just hit my head really hard, and that was about it. Yeah, eventually I'll get back on a dirt bike again. I'm not going to let it scare me. But I definitely won't be wearing just a trackies and a jumper next time. I'll be all geared up and properly. Safety first.
It's been 6 weeks since Nicola and Risky found a dazed Rudy, minus his underpants, and took him to hospital. Since then, he sought help for his alcohol addiction, and recently was happy to tell paramedics about his newfound hope.
You went to the rehabilitation centre and you stopped drinking?
Yeah, I haven't drunk for 3 weeks, and I've been all right. I've been much better, more stronger. It's hard, believe me. It's not easy.
As for brave schoolboy Max, it's been 2 months since Jamie and Mike were called to his school after he badly injured his arm when he took a tumble in the playground.
G'day, Max.
Oh, hi, Jamie.
How you going?
Today, Jamie's dropped by to check up on his little mate's progress.
Good to see you out and about.
Yeah.
How's the arm going?
It's going very good.
Yeah? What did the doctor say?
They said that I broke my ulnar radius.
Ouch.
Poor Max. It turned out that he broke his arm in 2 places and he was in a cast for 7 weeks, but it's good to see that his spirits are still high.
Yeah, this is for you.
Oh, thanks, mate. You didn't have to do that. Dear Jamie, thank you for taking great care of me when I broke my arm. From Max. Thanks, mate.
It's okay.
Now, how about you show me how to kick the footy?
Sure.
Sounds good.
We don't often get to see our patients, so to catch up with little Max and for him to write us a thank you card just means everything to us. Max is an absolute legend.
Wouldn't even be able to tell your arm was broken, mate. Yeah, it's all yours. Go.
Thank you.
Big kick. You could teach me a thing or two, mate.
At Melbourne's Alfred Hospital, 82-year-old Jim kept a vigil by his wife Jenny's bedside after she suffered a massive stroke.
In Jenny's case, that was an external bleed around the brain, with the neurosurgeon and a support staff and my family. And they really recommended that the life support system was not going to work. And was probably to Jenny's benefit that it be switched off or the ventilator be ceased. Initially, it was disbelief. When you awaken in the morning or in the night and she's not beside you bed, it doesn't hit you initially. Jenny was certainly the love of my life. I don't know what life will be without her. I loved her companionship, her understanding, how we both complemented each other. It was a beautiful relationship.
Finding out Jenny passed away was heartbreaking. The first thought that came into my mind was devastation for Jim. No matter how experienced you get, no matter how good you get at being a paramedic, at the end of the day, you're still dealing with people. You're still dealing with loved ones.
What gives me peace is knowing that when Jenny passed away, her Jim was right by her side. She was surrounded by her loved ones and she knew she was loved. It makes me appreciate what I have. It makes me go home and be grateful and thankful for my family, as I know that someone else's life has changed forever.
Emergency services, tell me exactly what happened.
I don't know the lady, but she can't breathe very well. She's really gasping.
In Melbourne's northern suburbs, a worried member of the public has called emergency services after finding an 85-year-old woman struggling for breath.
Her lips are quite pale.
Is she clammy?
Yes, she's clammy.
Okay, so just organising some help for you. Just keep reassuring her, all right?
As a priority zero, paramedics Nicola and Risky know this case could be a matter of life or death.
An 85-year-old female struggling to breathe. Doesn't sound good.
No. Priority zeros are the highest acuity cases we get dispatched to, so they're generally cardiac arrest, respiratory cases that are altered conscious state. It's basically people that are dying.
Clear left. Here.
Because the patient is so critically ill, multiple crews will be sent to help. But Nicola and Risky are the first to arrive.
There they are.
Respiratory jobs make me anxious. With someone in front of you that's struggling to breathe, you feel like you have to get in there and treat them straight away, whereas in actual fact, you need to do a proper assessment so that they actually have the best outcome.
Hello. What's your name? Marjorie. Marjorie, I'm Michelle. What's happening?
Just did some shopping.
Okay.
I know I couldn't breathe.
All right, so just relax your breathing. I'm going to have a listen to your chest, okay?
Worried bystanders called paramedics after finding Marjorie gasping for air at the wheel of her car.
The lady was tooting her horn, so we came over to see what was wrong, and she was struggling to breathe. She was in obvious distress and she said, "Help me, help me."
Just nice and slow. It's okay. She looks quite blue. Yeah, I know. I'll get some O2 on it.
Marjorie's fingertips and lips being blue, that clearly means she's not getting enough oxygen.
But Marjorie's problems could have an even more worrying underlying cause.
When the heart fails to pump effectively, it has a build-up of pressure which pushes fluid into the lungs. And that's what I think that is happening with Marjorie today.
It sounds like full field crackles.
Yeah.
Full field crackles is a sign to us that the patient has fluid all the way to the top of their lungs, and she's essentially drowning from the inside.
At the air ambulance base, paramedics have been called to an explosion at a warehouse in Kyneton, 90 kilometres northwest of Melbourne. A 30-year-old worker has suffered serious burns to the face and arms, a situation Micah flight paramedic Matt knows could be critical.
So we're going to a young male who's sustained some facial burns, which is a big concern to us. My concern is with facial burns that they deteriorate, their airway will swell, it'll close over and the patient won't be able to breathe.
With such potentially life-threatening injuries, the patient will need to be thoroughly assessed before he's transported to a burn centre. But the weather report is showing a problem.
Is that what's coming?
A band of storm clouds is moving in. If the team can't get in and out quickly, they may not be able to make the return trip at all.
We're not going to beat the shells, are we? We're going to be quite tight for time when we get on the ground. Yeah.
we're effectively flying into a large rain band that's coming straight towards us. So my aim at this point is to perform a rapid assessment of the patient to determine his level of injuries. But it's doubled the pressure on whether I can stay and intervene or whether I need to just package him as quickly as possible and return back to the burn centre with him.
A local ambulance crew has been treating the patient and is now waiting at the helicopter landing site. Now Matt needs to establish the extent of the man's burns.
Hello. G'day. How you going? How are you? Hello, mate. How are you? Oh, not too bad.
Danny.
Danny, pleased to meet you, mate.
Basically, there was a barbecue going on and there was a spray can of oil next to it. Too close, really hot, exploded.
Spray can of oil, like just a olive oil type thing? Yeah, yep.
Right next to it.
Okay.
So his face has got superficial burns. You can see the singeing of the hair and the eyebrows.
The guys at scene give me a short handover on what's actually happened, and I can see quite clearly he's sustained significant burns to his face. He's lost his hair on the side of his head, his forehead, his eyebrows, his eyelashes.
He said the flames went right around his face and head. Felt like he might have got a little bit into his lungs too. There is some redness and maybe a little bit of swelling at the back of his tongue.
More specifically, I become extremely anxious with people with airway burns. They have the potential to rapidly deteriorate to the point that we have to perform surgical airways on them by cutting holes in their neck. I'm very concerned about him.
Just breathe normally, mate.
Just focus on your breathing, all right? And just try and remain nice and still for us, okay?
Back in the northern suburbs, Risky and Nicola are urgently administering oxygen to 85-year-old Marjorie and have been joined by specialist Micah paramedic James.
Now, so do you have any heart problems?
Yes, I've got a pacemaker.
We've got a pacemaker.
With fluid-filled lungs and a failing heart, Marjorie's situation is critical. But before they can escalate treatment, they need to get her out of the car.
Any heart attack before?
Yes.
Yes?
We need to be really careful with these patients because the smallest amount of movement from them can tip them over the edge.
Just leave all that there for the moment, okay?
Don't want to put too much strain on the heart that's already under a lot of stress.
We're going to slide this under your bottom, okay? That's it. Now, we're going to slide you onto our bed, okay? You're right there.
Ready? 1, 2, 3. That's it.
Marjorie could go into cardiac arrest any time and urgently needs hospital care.
Is your breathing feeling any better with that on?
Not much.
Not much, okay.
But while she's made it safely to the back of the ambulance, for now, they're unable to take her any further.
Marjorie's one of the sickest patients I've seen, but before we can get her to hospital, we need to actually make sure that she's stable enough that she's going to make it all the way there, because at this point, without any intervention, she may not make it.
I'm just going to have a listen to your chest, so I'll get you to take some nice big breaths. You can keep going with the water if you want.
In country Victoria, air ambulance paramedic Matt is assessing Danny after an explosion at a workplace barbecue.
He's had 15 milligrams of morphine and 12.5 of Stimatol.
No worries.
With bad weather forecast, Matt urgently needs to get his patient into the air ambulance and to a Melbourne burn centre. But he's worried Danny's scorched airway will need treatment first.
Open up your mouth, stick out your tongue for you, stick it out, nice and just open your nose, so you keep going, you're right, just breathe normally, mate.
So the irony of this whole situation is Danny is having a WorkSafe meeting at his place. He's having a barbecue to finish off the day, and they have an olive oil spray can which all of a sudden has exploded. With Danny, I'm concerned that maybe that sudden release of air has caused his lungs to actually collapse.
And your lips, are they sort of... Yeah.
So Danny was thrown backwards from the explosion. He couldn't see initially. He's in severe amount of pain. The first thing he does is sticks his head in a bucket of water. So he's been exposed to a significant hot force here.
While he has sustained some burns to his airway, Danny's breathing is stable enough for him to travel. But with the storm now moving in, Matt's running out of time to get him airborne.
Righto, we're going to do this quick, so literally bed out and we're going to swap you straight across and get you moving.
So I've assessed Danny and I established that his airway is okay, but now I'm concerned about the weather. The weather's closing in on us. We need to get a move on with getting him to hospital.
Right, mate. So quick flight back to Melbourne. It'll be about 15 minutes of actual flying time.
I'd normally get an umbrella out for you, but I reckon you're enjoying that.
Fortunately for Danny, the rain starts to drizzle down on him and he's got cool fluid coming onto his face, so he's probably enjoying that moment of relief he gets there.
This is good. Cloud base is fairly high. It's just this light suspended rain that's making the viz come down a bit.
With its cooling effects, so far, the weather has helped more than hindered. And as the flight gets underway, a saline drip helps soothe Danny's burns.
You want any more pain relief? No, it's not too bad. It's only hurts when I pull this away from it. Yeah, no worries. Nothing beats the feeling of having cool water running over a burn after you've had an injury.
But although his pain is manageable, Danny's situation is precarious.
Danny has been exposed to a significant heat source here, but it's not just the flames I'm concerned about. It's the shock waves that are associated with an explosion. So you can penetrate and burst or rupture internal organs, eardrums and those sorts of things. So I can never be 100% sure about what's actually going on until you've had all the diagnostic tests at the emergency department.
How we going, Danny? We're at the Alfred Hospital, mate.
Danny's future is uncertain. But as he arrives at the burn centre, at least the weather is still being kind.
So that cool breeze is probably nice.
Yeah, that's real good, man.
Yeah. So a few bumps as we come out, mate.
See where you, mate.
In the northern suburbs, paramedics Risky, Nicola and James are unable to get their patient to hospital until her condition stabilises. 85-year-old Marjorie's lungs are filling with fluid and her failing heart could go into arrest any time.
It's rattling in your chest.
It is, because it's fluid in there.
I'm going to put some tablets under your tongue, okay? Just lift up your tongue. That's it. And leave them there and just let them fizzle away, okay?
Medication will help lower Marjorie's blood pressure, but the team must get more oxygen into her lungs if they're to save her life.
I'm going to swap the mask over, okay? We're going to give you a bigger one. This one's going to feel a bit uncomfortable, okay? What this mask does is it has continuous pressure going into the lungs, which forces those air sacs open so you can get more oxygen being transferred into the blood.
How are you feeling, Marjorie? Is the breathing feeling a bit better? Okay, all right. Let's get going.
With the specialised mask forcing oxygen into her lungs, Marjorie's breathing stabilises enough for her to make the journey to hospital. But she's not in the clear yet.
Driving to hospital, lights and sirens with a critical patient in the back, I don't think I fully relax until I'm through those hospital doors.
That's really good. You're doing really well.
Elderly patients don't tend to bounce back as fast. So even though our management might be working, they're still critically ill patients. You know, there's still things going wrong. In this case, her heart. You know, you just hope for them that they can get better, but we know in reality that isn't always the case.
Marjorie will now be rushed to the emergency department for urgent treatment by cardiac specialists. Just outside the city centre, Leonard and Nat are enjoying a quiet start to their shift.
I had my 3 kids at Cabrini. Excellent maternity suite. In case you're looking one day.
No, too early for that.
Okay, we're still working on the proposal. Okay.
You've put me off children.
No,
talking
kids,
about...
kids are great. Kids
Now
are
you say
awesome. Kids are awesome. I come home every day after work and look at my 3 beautiful children and think how fortunate I am to have a happy, healthy, loving family.
I wait till I hit 30 and then I might think about children.
And then I think about Leo, and he's coming up to almost 10 years with his gorgeous girlfriend, and he still hasn't popped the question, what is he waiting for?
We'll do the proposal.
Okay.
Then we might have a couple years engagement.
Oh, Leo, you drag things out, don't you?
I take my time.
9 years to propose and then 2 years to actually get married?
Isn't that normal, 2 years?
No,
I don't, maybe 9.
no, it's
I
not.
might have pushed it a little bit too far.
No, it's not normal.
Larissa and I have been, I shouldn't say dating, because that's too weak of a term, boyfriend and girlfriend for a very long time. Ever since I've been partnered up with Nat, she has been giving me absolute hell about waiting 10 years to propose.
Good boy, Oscar. Larissa does everything for me. You know, she's my best friend, my #1 support.
Let's go on the water, Oscar, come on. Good boy, go.
Of course, Oscar as well. You know, he's my fur baby. He's my son to me.
Go on, sweetie. There we go. Everything we do is for Oscar. So, yeah, we're a tight little family. Good boy, Oscar. Come on, sweetie, let's go.
Who do I love most out of Larissa and Oscar? I'll be getting in a lot of trouble for this. I think maybe sometimes I look forward to seeing Oscar a bit more when I walk through the door, but no, I'll say both.
But Leonard's personal life must wait. The team has received their first case of the day, a code 1 to a patient in the city centre.
Okay, so what are we going to?
78-year-old female.
Okay, and we're complaining of chest pain.
Chest pain is an actual problem.
Main problem.
It's history of AF.
History of AF.
Atrial fibrillation, or what we call AF, basically means a very fast and irregular heart. So on the way to the job, I'm thinking, do they have chest pain because their heart rate's too fast? Or are they having chest pain because they might be having a heart attack? Either way, this could be very serious.
I think we should take oxygen.
I think so as well. I agree.
There we go.
Yes, thank you.
Hello.
Hello, sir, in here.
On arrival, they find 78-year-old Judy collapsed on a bed.
I want you to take a really deep breath in for me at the moment and tell me if that pain changes or gets worse in any way.
As a heart attack is suspected, Leonard urgently needs to establish if her life is under threat.
Have you ever had this chest pain before, Judy? No.
When me and Nat walk into the scene, I can see Judy lying down and she appears to be in quite a lot of pain. I can also see Robert, the husband, in the corner and he looks quite scared.
Point exactly to where you have the pain. With this hand?
Yep.
Right on the side there. When you push into it, does that feel like the pain gets worse?
Husband Robert called paramedics, worried Judy is having a heart attack.
This basically takes a snapshot of the electrical activity of your heart, Judy. Yep.
He's about to find out if his instincts were right.
Looking good.
Looking good. There's a lot of jargon on that, but there's nothing that's overly concerning that's saying that it's a blockage of your heart.
And it's good news. But although Judy isn't having a major cardiac event, her heart function could still be compromised.
So I like to pop a needle in your arm.
Yep.
We'll give you something for the pain. The other question I need to ask is, and this is a bit of a weird question, is have you had a medication called Viagra?
I know.
I know, that's the reaction I get all the time, and I'm not even joking.
I don't think you have either.
It is a normal question, a very embarrassing question to ask, but we have to ask it. I need to administer a medication called GTN. GTN takes pressure off the heart. Unfortunately, when combined with Viagra, it results in a very, very large drop in blood pressure, and that's the situation we just don't want to have.
All right. So we still need to take you to hospital, get some blood tests done.
With Judy's pain under control and fears of a major heart attack put to rest, the team is heading to the nearby St Vincent's Hospital.
When you have a minute, Judy, you need to tell Leonard about the special occasion you celebrated this week, okay?
We had our 50th wedding anniversary.
Congratulations.
Thank you.
That is a massive achievement. What's the secret to 50 years? There's got to be some kind of secret.
Take 10 years to get married.
Take 10 years?
60 years we met.
So I'm listening to Judy and Robert's story and I'm thinking, how sweet. But then I hear that it actually took Robert almost 10 years to pop the question. And it reminds me of Leo. Now you're going to tell them your story.
Because it's been 9.5 years and I haven't proposed yet.
You haven't proposed?
No.
Well,
that's the face that I get every time I say 9.5 years.
But have you been in the same city all the time?
I have.
Have you been living together?
For 2 of those years.
Right, okay, fair enough.
But I've got no excuse.
I love how I keep harassing Leo about when he's going to pop the question. And all of a sudden, we've got Judy in the back of the ambulance and she's also harassing Leo. I am thoroughly enjoying this job.
So Robert said the key obviously is to wait 10 years.
He proposed by letter, but because he was the other side of the world.
Gives you some ideas how you can propose, Leo.
I know.
Yeah.
I'm going to have to.
Yeah,
Oh,
you'll
my
have to
goodness.
write to your girlfriend.
How
Send
should
her a
I
letter.
propose? I need some advice.
No,
for
after
10
all
years.
these years, I think you need to arrange something
I think so. A little bit more romantic. She deserves that much.
Yeah.
Yeah. So I've been feeling the pressure about when to propose, how to propose. I've had Nat on my back every single day. And now I've got a patient who's telling me, make sure it's special, make sure it's romantic. Give a man a break.
Leonard, if you love her and if your sense of humour and hers complement each other and you don't drive each other mad, for goodness sake, get on with it.
Couple of bumps, yep.
Judy will now be tested to see if there are any issues with her heart function.
It was great listening to your story, it really was.
When we drop Judy off to hospital, I'm feeling confident that she's going to be okay, that her and Robert are going to continue this wonderful love story for many years to come. And Judy, don't worry, I'll let you know when I finally propose.
Emergency services, tell me exactly what's happened.
It's the start of the evening shift for paramedics Jamie and Mike when they're called to a road accident in Melbourne's northeastern suburbs.
It looks like a head-on collision with a motorbike.
A motorbike and a vehicle, is it?
That's correct.
Patient complaining of left hip injury. They'll be thinking C-spine, be thinking pelvis. Oh, we've got people here on the side. That looks like a bike. Right. G'day, guys. I'm Mike. I've got Jamie with me. Were you on the bike, sir?
I was on the bike.
All right. Is anyone else injured?
No.
No. Okay. How about you come and take a seat in my ambulance? All right, because you're already up and moving. Let's get you over there.
Yeah.
Miraculously, 60-year-old motorcyclist Steve has been back on his feet since the accident occurred and appears completely unscathed. But his bike has seen better days.
Just going to pat you down head to toe, make sure everything's all right.
Yep.
So no pain in the head?
Nope.
Any
Nope.
pain in the neck when I'm
Nope.
pushing? Nah,
All
great.
good.
Poke your tongue out for me. Good, no blood in your mouth, anything
No.
like that. So I'm in the back of the ambulance feeling for any injuries. I checked him from head to toe. Oh, yeah, you've got a tiny abrasion there.
Yep.
And all I can find on him is this little scratch on the back of his leg. He's T-boned the car at 60 kilometres per hour. He's then been thrown over the handlebars, done a bit of a flip and a pirouette and whatever. I was surprised that he didn't need the helicopter, let alone being able to walk off the road.
Although Steve's only complaint is a bruised leg, Mike can't rule out an internal or spinal injury.
Your conscious state is good, but I want to take you to the trauma centre, which is the Royal Melbourne from here. He feels fine, but at the same time, he's willing to let me put a firm collar around his neck. Just relax your head back for me, mate. I know he's got to have injuries somewhere. You can't just walk away from that unscathed.
Meanwhile, Micah's single responder Mark has also been called to a road accident. But so far, he's been unable to find it.
I think it's that way. I think it's this way.
He's now in a convoy of emergency vehicles desperately trying to locate the job.
It's just a mismatch between where the call has been placed from in terms of the location of the accident and where the emergency services actually are.
Evening, how you going?
How you going, mate?
So the situation is the fire is going to flip back to make sure we don't make any mistakes.
Sure.
Otherwise, I think it's just going to be unable to locate at this stage.
Okay, mate.
With the job now cancelled, there's time for a quick bite to eat.
Oh.
But not for long.
Support 215. I'm a Micah single responder with the, was that with Mulgrave?
Mulgrave, support 215, and it'll probably be Micah 26, I'd say.
215, receive, thanks.
Just a few kilometres down the road, a woman has been spotted inside the shattered remains of a car, now wrapped around a pole.
It rains at pours in this job, it's unbelievable.
With the other emergency services working to secure the scene, it's Mark's job to check on the driver.
Jesus, what a hit. How you going? Mark is my name. Just stay there for us, all right? Can you talk to me? I'm gonna get some monitoring on you, okay?
As I walk up to this car wreckage, my instinct is that this is going to be really bad. But miraculously, I see that the driver's talking and moving around the cabin of the car, and despite all the odds, she's actually survived.
Where are you, Sordal?
Have you got any pain in your legs?
Because her spine may be injured, Mark needs to keep his patient as still as possible.
She's sort of moving herself out, yeah.
But all she wants to do is get out of the car.
Just stay there for us, Dale, just until we get set up to get you out, okay?
As a paramedic, it's really frustrating when you're trying to help someone involved in a car accident and they won't cooperate. Despite my repeated instruction for her to stay still, she's just making every effort possible to get out of this crumpled wreck.
Can I just get an ETA on Oakley, thanks?
Oakley for an ETA, please.
Thanks, guys. It's single occupant. She's conscious but heavily intoxicated and non-compliant. She's actually freed herself from the vehicle, so the sooner the better, thanks.
While Mark waits for an ambulance and stretcher to arrive, his patient is becoming increasingly difficult to manage.
Just stay there for us. Just sit there for us.
No bed.
Yeah, you need a bed.
I don't need to be in
Yeah, you do.
So are you over here visiting or you're living here or?
No, I'm an Australian citizen. I've lived here for 23 years.
Oh, and you haven't picked up the accent yet though?
No.
Paramedics Mike and Jamie are having a much easier time with their patient.
Yeah.
Despite having just been thrown from his motorbike, 60-year-old Steve is in high spirits.
And your wife, is she American as well? Or?
Yeah, she's a Boston girl.
So you've been here for, sorry, how long?
23 years.
23 years. You're almost more Australian than I am, mate.
There you go.
Steve's the sort of patient that we really want to have, you know. He's walked away from this really serious accident and miraculously he's got next to no injuries. We just have to make sure he hasn't injured his spine or his neck. So we ended up taking him to the Royal Melbourne.
Jamie has a long drive ahead of him to the trauma centre, but the upbeat conversation in the back is still going strong.
How many kids have you got?
I got two. I got a daughter that just had our first grandchild.
Oh, wow, that's awesome.
Yeah.
Really good to work with Mike, actually. Mike has an absolute heart of gold and he loves a chat.
Oh, I'm from down southeast of here, if you know the Mornington Peninsula, Frankston sort of area.
Sure.
Doesn't stop talking.
Beautiful to take your bike down to in summer. Very busy doing that,
Does not stop.
I've got a consulting business, maritime and oil and gas. So,
Okay.
So yeah, this is not convenient because I was just getting ready to go back to work.
It was actually funny with Steve. He's the one that's in the ambulance as the patient and he's out talking Mike. I didn't think this was even possible.
I've only been back in Australia the last 2 years because I spent about 8 years living in China.
Yeah. Steve is so chilled. I don't need any pain relief. Telling me about his life, telling me about all the shenanigans he gets up to. He was the best patient I had all day.
But despite Steve's high spirits, there's one thing that's been playing on his mind.
I don't want my wife to see the bike, and I don't want her to see me. She would definitely freak out.
No.
Just stay there for us. When Oakley arrive, we'll get us straight to the bed, mate.
Single responder Mark is still having a tough time with his uncooperative patient.
Just sit there for us.
I don't need to be here.
Yeah, you do. Yeah, you do.
The ambulance crew has now arrived, but having already extricated herself from the car, all they can do is help carry the driver to a waiting stretcher.
Come on, Doc. Put your shoe on. Put your shoe on.
I want my shoe.
Come on. Shoe will come with you.
Righto.
It's a miraculous story of survival, but the patient is far from happy.
No, my phone.
We've got your phone, all right?
Where?
And so far, Mark's had little opportunity to assess her.
Where are you sore?
No.
Sorry. You've been involved in a really, really nasty car accident, okay? You're lucky to be alive, all right?
If the patient was cooperative, my plan would be to keep her dead still, apply a collar to her neck and stabilise her condition accordingly. Any case involving major trauma, we know that there's significant potential for the patient to deteriorate on the way to hospital.
She has settled remarkably without analgesia, and I want to make sure that's not a deterioration as well.
But before Mark can even start treating his patient, her condition takes a worrying turn.
Are you sore in your hips at all? Just say yes or no, you are?
Still warm enough there?
No, I'm good.
Excellent. Pain still the same?
Yep. No, laying like this is perfect because it's when I get up, I'm going to be stiff.
Yeah.
Mike and Jamie are now over 40 minutes into their journey to the trauma centre with fallen biker Steve.
This is for my daughter. Don't be silly about it. Okay, yeah, blah, blah, blah.
So far, he's been in remarkably high spirits, despite having just been thrown over the hood of a car.
My wife, she's an ex-medical person, so is a big hater of motorcycles. Hey!
But when Steve's wife gets on the phone, it becomes clear why he's been so keen to keep things upbeat.
Oh, I'm in an ambulance. Don't say oh shit, it's fine, I'm good. This is just, what's it?
Very succinctly, she hates motorcycles. She suffered me riding, you know, that she sucked it up.
Honestly, I'm good, dear, I'm good.
He's more worried about upsetting her than he is about his own injuries.
The bike is definitely a lot worse for wear.
And he also wants to keep his motorbike.
Are you sore in your hips at all? Just say yes or no, you are?
After a worrying quiet spell in the ambulance, single responder Mark's non-compliant patient starts coming round just as they set off for the hospital.
What's going on?
We just need to put this around your neck to keep your neck nice and stiff.
But her behaviour is as unpredictable as ever. Now, she's choosing to cooperate with the crew.
How you feeling? You right?
Surviving.
Good on you. You've done really well.
The patient's behaviour initially proved very challenging. She was feisty and uncooperative, but finally, with the benefit of some pain relief and reassurance, she's finally calming down for us.
Mate, I've got a nice pulse rate.
Yeah, put me in there. Right.
But just as I think that she's calm and relaxed, there she goes again.
I've been in any car accident.
You have been so lucky to survive that accident tonight. Okay, you...
Why can't you take me home?
We're just arriving at the Alfred Hospital.
Dealing with an uncooperative, non-compliant patient is really frustrating as a paramedic. It sort of gives you a feeling like you're doing your job ineffectively. But we do know that those are the sorts of challenges that we face, particularly in dealing with intoxicated patients.
Great. Arrived.
Let's just say that it's really pleasing to be able to deliver this patient safe and sound. I really do wish her well with her recovery and hope that her stay in hospital is short.
Just lay down and relax, okay?
You're right.
Just try and stay still for us, all right?
Yeah, no, I've just got a corky. You know, luckily I was going about 60. A young gal just popped out and T-boned me, and I didn't even have a chance to brake.
Back in Mike and Jamie's ambulance, 60-year-old Steve is still trying to pacify his anxious wife.
No, I'm good. No, well, they're taking me to the hospital to have it looked at, so.
God. Steve and his motorbike. Yeah, I don't like them. Motorcyclists are potential organ donors every time they get on the bike. So it was always a very contentious issue with us.
Love you too, babe. Bye, sweetie.
You're a good lad. She's obviously worried.
I would say within 30 seconds after hitting the ground, all I heard was my wife's voice, echoing, and I knew I was going to get a very serious "I told you so."
Steve must now endure a series of tests at hospital to find out if he has any spinal or internal injuries. Not to mention a difficult conversation with wife Sarah about the future of his bike.
Just gonna lay a few cords over you, my friend. Yeah, keep your hands in.
And Mike, well, he's seen it all before.
Oh, yes, he's certainly going to do what his wife wants. He's certainly going to give that bike away or sell it. Although I don't think there was much left of it anyway.
Nice flowers, I like these ones. Carnations.
It's just 24 hours since Risky and Nicola were called to help 85-year-old Marjorie as she struggled to breathe at the wheel of her car. With a failing heart and fluid-filled lungs, the odds were against her making a full recovery.
Hi, Marjorie.
Let ambulance drive.
There you go.
But Marjorie has proved to be exceptional.
How are you feeling?
Thanks, love. Oh, much better, thanks.
You're looking a lot better.
Oh, yeah.
Yeah.
There's no way I could breathe.
Yeah.
And I just felt all the fluid rattling in my throat and my chest.
Yeah, we could hear
I
it.
just couldn't breathe.
Marjorie's really lucky that all the circumstances came together as they did. I mean, she was on her own. She got short of breath. She didn't have a way of calling the ambulance herself. So to see her looking like this today is amazing. She looks like a different person.
Tests showed one of Marjorie's heart valves was faulty. If she hadn't alerted passers-by as she did, she might not have survived.
You were the sickest patient we've been to for a while. You were really unwell.
Well, let's see, that proves you can do it. You can do miracles.
But you helped yourself as well by tooting the horn. So if you hadn't have tooted the horn, Marjorie, things could be different. So good on you as well, yeah?
Right.
Yeah.
I try to be a bit sensible sometimes.
Yeah.
So as much as respiratory patients scare me sometimes, seeing Marjorie sitting up with a big smile on her face was such a satisfying moment. To know that she's actually continued to get better, that's a sense of achievement. That's what we joined this job for.
Thank you, Marjorie.
You're doing a really wonderful job. I'll never forget your kindness to me.
Glad we can make a difference.
You certainly do.
After a can of spray oil exploded at his work barbecue, Danny was airlifted to Melbourne's Alfred Hospital. No internal injuries were detected, and he was released a few days later with second-degree burns. Danny's now recovering, and the good news is his hair, eyelashes and eyebrows are all growing back.
Yeah, no, I've just got a corky. Luckily I was going about 60. A young gal just popped out and T-boned me.
Fallen biker Steve was Mike and Jamie's most positive patient of the day, despite having just been thrown over the bonnet of a car.
Honestly, I'm good, dear. I'm good.
But was he trying to keep things upbeat for wife Sarah? And did he get to keep his bike?
So while I was at the hospital, it wasn't too bad. I felt much better once I saw him, even though he was laid out straight with a collar on.
Steve,
Yep.
Do you want a cup of coffee?
Yeah, no, I'll definitely have a coffee.
Okay. It turned out he was okay, but he was so lucky he just landed right side up and not on his head, because I probably wouldn't have a husband right now. So this is a little bit different, me waiting on you.
It certainly is.
Please don't get used to this. Please don't.
My future on a motorbike, there is no future. I've given up riding now. I actually had some fractures in the lower bone of my leg, and I had severe bone bruising, and my knees were really, really unstable. Honestly, I would love to continue riding, but my 4 sisters also chimed in on this, along with my lovely wife and my gorgeous daughter and my granddaughter. Yeah, so no, I don't have a chance.
Now that you're not riding motorcycles,
Yeah.
what activity are we going to do now that I have to say no?
I thought I'd do something a little bit safer, like base jumping.
I think it really was a closing of a chapter, and he doesn't want to do it anymore, which is really good. It's really good.
I could take up crocheting.
I'm really glad you're still around.
You bet.
Judy's husband, Robert, was worried she was having a heart attack. But tests were unable to find anything wrong, and she was sent home from hospital in good health. As for Leonard's revelation...
It's been 9.5 years, and I haven't proposed yet.
You haven't proposed?
No.
Some progress at last.
So the morning of the proposal, I actually started to get a little bit of doubt creep into my head whether she would actually say yes.
But sadly, it was news about their fur baby Oscar that finally prompted Leonard to pop the question.
So Oscar's been diagnosed with bladder cancer and doesn't have too long to live.
The vets essentially told us that unless some radical new treatment or drug therapy comes out, that we're just going to have to take care of him and make him comfortable, which is extremely hard for me because he's been a massive part of my life. So.
Sorry.
Sorry, I didn't actually think I was going to cry.
Having Oscar involved was unbelievably important. There was a whole range of emotions, I think, as I was proposing. Obviously, I was tearing up because Larissa was tearing up. I felt a big relief as well, and a little bit of guilt because I did wait 9.5 years, and I think she made that known to me that maybe I could have done it a little bit earlier. But hey, she said yes, so I'm a happy man.
Emergency services. Go ahead, caller. What address do you need the ambulance?
In Melbourne's Emergency Communication Centre, a call has just come in from remote country Victoria.
Well, I'm on the top of King Billy Track, northeast of the Snowy Plains airstrip.
This is now a job for the air ambulance.
I've got a compound fracture in my left leg.
All right, I do understand, sir. How did that happen?
I was sawing a log off the road and the bit from the top side slipped down and jammed my leg and broke it.
Okay, so right now, can you see any blood pouring or spurting out?
No, we put a bandage on it.
All right.
That's my boot on.
This call may sound remarkably calm, but 59-year-old Rob and his wife Trudy are in trouble. With Rob in intense pain from a broken leg, they're stranded in the Alpine High Country, 140 kilometres northeast of Melbourne.
And how's the pain? What are you feeling?
Oh, nothing playing.
Yeah, I do understand.
The rescue location is covered in dense bush and darkness is approaching. Micah flight paramedic Ray and the team need to get there quickly to make sure they can get the patient off the mountain.
About 4 minutes run, 10 miles.
We call it Tiger Country because that's where if things go wrong big, and it's generally either cold or extreme and it's remote.
3 o'clock load, got some people signalling us. Roger.
Right now, getting the chopper down safely is the first challenge.
Paramedics' role in this case is to look out for any obstacles that can endanger the aircraft.
Ray, you can have a look as we're going on the right-hand side. Okay, got you.
communication between all three of us is now probably at its most extreme. They're calling out basically every foot and every metre and every clearing, every tree.
Right to the ground. Come down slowly, surface. Good, slight slope. Come down, left mate's coming on. And solid. Slowly bring the power out. Yep.
As they unload the gear, a couple are standing by a four-wheel drive to meet them.
What's your name, mate?
Robert.
Rob, my name's Ray. And I remember turning to the guy I was working with and go, you think that's the patient? It's like, nah. And then he starts hobbling towards us.
Stay there, we'll bring a stretcher to you.
And I go, he doesn't need to be walking. He's got a clearly broken ankle. I can see that from here. And he's going, no, I'll hobble to the helicopter. Geez, they make you blokes tough. You come to us. First thing through my mind, it must be a country bloke. You can just tell they're self-sufficient, they're tough. They have to do what they need to do to get things done. Come with me, come with us. Do the dance, bottom right here, and I'll give you a hand with that leg, okay? No, it's on.
Do you want to take the other boot off?
Right on the ankle?
Down low, yeah.
All right, mate. How about we get you out of here? We might get you in somewhere a bit warmer.
You're in charge, mate. No,
yeah, no problem.
As tough as this farmer is, the shock of the accident and the severe pain is starting to take a toll.
Rob's just sitting up on the stretcher now. The face is trying to be stoic, but it's broken. And we knew it was hurting. Yeah, Rob was in some serious pain.
That's hurting.
Emergency services.
There's a guy in the middle of the road. He's been hit by a car. Oh my God, he's jumping in front of people. He threw himself onto my bonnet.
Mobile intensive care paramedic Mark is responding to a panicked call for help in Melbourne's eastern suburbs.
Yeah, this does sound bizarre.
He's got mud and dirt and he's drenched, literally hugging a tyre like the car's trying to get away.
You keep yourself safe in case he's violent. The services are getting out to you as quickly as they can.
As Mark makes his way to the scene, an update comes through. The man is reportedly drug affected and poses a serious threat.
There is a male there who is reportedly armed with a weapon and feels to be middle floor.
Support 215 and TM 1541. Receive that, will do.
Responding to patients affected by drugs is a real challenge for paramedics, especially when it comes to patients that we believe are under the influence of methamphetamine or ice. Those patients tend to be incredibly violent, very agitated, and I know that unless my safety can be guaranteed, then I can't actually be there to perform my role effectively.
This is an interesting scene.
Responding to a case like this, we know that essentially we've got to expect the unexpected. It's getting dark, it's starting to rain, and I can tell that the tension is really high, and we need to work out exactly what's going on quickly.
No! The coppers are corrupt.
That's hurting.
All right, mate. Okay. Now, you normally well, Rob?
Yeah, good as gold.
Good as gold?
No medication.
No medications.
No pills.
Up in the Victorian High Country, flight paramedic Ray is about to start treating 59-year-old farmer Rob.
It's all right, I'll just get this bandage off.
Yeah, just cut it if you have to.
Yeah, I will.
Rob and his wife Trudy were on a four-wheel driving holiday that ended in a terrifying ordeal.
We were just coming down a track and there was a tree over the road. So naturally, Rob, who's a farmer, used to cutting trees and so forth, got the chainsaw and started to get it off the road.
But the tree slipped, ripping open Rob's lower leg and pinning him underneath.
I remember thinking, if I can't get him out, I'm going to have to go and leave him there.
Luckily, it was Rob's jeans that were caught under the log, so Trudy was able to cut him free.
I unzipped the zipper on his boot and could see it was filling with blood. He was as white as a sheet.
Chase, you want to snap a tourniquet on one of those hands for me, mate?
Good, that's started the bike.
All right, so what we're going to do, we're going to give you something for that, and I'll keep looking at this a little bit.
As Rob braces himself for the worst, Ray carefully removes the sock to assess the damage.
The sock really started adhering to the clots in the wound, and I'm trying to gently pull that off. And we're wetting it down and pulling it off. And yeah, he starts rumbling around on the stretcher again. I don't blame him. All right, so what's happened? Your sock's probably stuck to your wound. Yeah. Okay, so you fracture that quite bad.
You right, mate?
Yeah, just starting to shake, that's all.
The bone's almost sticking out. That makes it look gruesome. He needs to be somewhere where they can take care of that injury and all the possible complications.
Single responder Mark has arrived at a volatile emergency in Melbourne's outer east. A young man has gone on a rampage, throwing himself at cars on a busy road, causing chaos and bringing traffic to a standstill.
Mark is my name. We're the paramedics. We're getting some ketamine organised and we're going to sedate him and then look after him, OK?
Based on what I know about this patient, he could absolutely have life-threatening injuries, there's no doubt about it. But I actually can't get close enough to him to properly assess him. So sedation really is the next step for me in this situation. It's not a decision we take lightly in ambulance, but in this particular circumstance, it's absolutely critical that we get some sedation on board so I can formally assess him and work out what injuries he's got underlying.
With the man secured, Mark can now administer a dose of ketamine, a powerful sedative.
Just relax, mate. All right, guys. Everyone sharps out, guys. All right?
No, they're not. It's all devils.
Guys, we're just getting the bed and the restraints organised, and when we're in position, we'll get him straight up, loaded, restrained into the back of the ambulance, all right?
Tara was driving along the road and witnessed the man's erratic behaviour.
He was throwing himself like under wheel arches and he was trying to get in cars, and two of his friends stopped and they said he's just jumped out of our car like we were driving and he threw himself out. They go, we've never seen anything like this before from him.
Is he quietening down a bit?
Quite strong.
We'll give it a few more minutes, guys. Let's get him up and onto the bed first.
With light fading, rain falling and the temperature dropping, Mark's keen to get the patient into the ambulance for a full assessment.
So guys, we're satisfied the restraints are on appropriately. Yep. So collar on, non-rebreather at 10 litres a minute, triple airway manoeuvre if necessary, and then we need monitoring and an IV access, all right? In my experience, when the ketamine starts to wear off, he'll be awake and kicking and punching and spitting, all right?
So I know that the first dose of sedation that we've given will be short-lived, so it's an absolute priority that we get an IV in now and be in a position to provide ongoing sedation.
OK, guys, he's starting to wake up, so IV going in.
If we allow the sedation to wear off, it's going to pose an enormous threat to us.
Oh, Jesus, he's starting to wake up. OK, hang on a second.
No, stop first.
Uh. 59-year-old farmer Rob is being treated in the air ambulance after his leg was torn open and pinned under a tree in Victoria's high country.
It's okay, you're gonna be fine.
Flight paramedic Ray has finally managed to remove the blood-soaked sock to reveal what's underneath.
So we get to the point the boot's off, the sock's off, and like, wow, this is quite a big injury. He's got an enormous laceration there. It looks like a fracture, but it could involve possibly a fracture dislocation. It's right down on the ankle, so it's a complex joint, and this is quite a complex injury. All right, these sting, okay? So relax your foot, relax your foot.
Pain relief is on its way, but it's so cold. The only place Ray can find a vein is in Rob's foot.
Oh, that bit up my toe. Shit. Ah, it's going right up my toe. Oh.
The foot's clearly a pretty tender place to put an IV. It's not something we routinely do. Does it stop being up your toe now?
Oh, a little bit.
Three-way. Thank you. So Rob's facade's crumbled now. He's been stoic up to this point. Something had to give. But it's good because we've got IV access and now we can give him all the drugs that we really need to give him to really go and have a look at this leg. These are the no pain, no gain things.
Well, just about, isn't it?
Okay, feel some water shooting up your foot. All right, so you just got a wad of pain relief, okay? What I'm going to start doing is cleaning this wound up.
Yep.
We're going to bandage it.
Yep. Well.
And I can guarantee you, we'll splint it, it ain't going to tickle. Part of making Rob comfortable is splinting that leg so it just doesn't move. So then we can do things like elevate it and all the simple things that you do to ensure that there's really no more complications. All right, so we'll just get this splint on, keep this joint nice and tight. Well, you want to prevent further damage to nerves as well as blood vessels. I mean, the bone is what it is now at the moment. And we're almost ready to roll, really.
As the air ambulance crew prepare for the 45-minute flight back to Melbourne's Alfred Hospital, Rob's now feeling guilty about his wife, Trudy, having to drive 2 hours off the mountain on her own.
You don't worry about me, you just be careful getting home.
Yeah, I'll be right. Okay, go down.
I knew we were going to get out, I wasn't worried about that, but I was more worried about how my mate was going to cope. That's a bit scary, like you're stuck up there miles from anybody and dark and wildlife on the road. There's a creek to get across. Some of the switchbacks are a bit rough.
Just sitting right turn, rolling, left right. That was clear.
Trude's my best mate. Yeah. It was hard.
M1 airborne to the Alfred with an ETA there of 1752. Yeah, that's right. They're expecting it about that time. Thanks, mate.
Farmer Rob is being airlifted to the Alfred Hospital after a tree fell on him in Victoria's remote high country.
Meters coming on. This will warm up pretty well. About 5 minutes.
His wife Trudy, a nurse, managed to cut her husband free, bandage his severely broken ankle, and get him to the chopper.
Yeah, no, much better, thanks.
Glad I had Trudy there, not somebody else. Because I know if she says we're in the pulp, we're in the pulp. If we're not, we're not. I didn't actually think it was as bad as what it turned out. Like, I felt the pressure on my leg, and then I heard Trudy's voice saying, "Oh, Webby." And I thought, oh, this doesn't sound too good. And then when I looked down and had a look at my leg, I thought, it doesn't look too good.
With such a bad injury, Ray, the Micah flight paramedic, keeps the pain relief coming.
I was just going to give you a little bit now, a little bit when we get to hospital. Just keep you nice and comfy. Yeah,
I'm looking at that ankle and thinking he's a farmer and he loves being outdoors and it's quite active. If this joint's not fixed properly, he will lose mobility, he could lose his livelihood, he could lose his love of the bush. He can't afford in his profession and what he does for a living, and he can't afford it in his lifestyle.
On the ground about 3 minutes, guys. Great, thank you.
But right now, Rob is just grateful to the team for getting him off the mountain.
On the ground.
You can't say much because thanks doesn't seem like enough. One way to get to Melbourne, isn't it?
It's quicker than driving.
Pretty amazing that there's people out there that do that for other people.
Now in the capable hands of the Alfred medical team, Rob's about to find out his fate. This injury could change the course of his life.
Okay, sharps out, guys. Let's get this IV in as a priority.
On a busy road in the outer suburbs of Melbourne, Mark and backup paramedics Amy and Jeff are treating a patient who's just been involved in a frightening sequence of events.
3-way ready. Let's get this secured off. Hold that. Hold, hold, hold. Relax. Release. Release. I've got it. I'm good. You pop it on. Good man. Thank you.
So what's happened is he's jumped out of a moving car with his mates. He's then jumped on the bonnet of a lady's car, attempting to get inside it. And she's driven off with him on.
Okay.
So he's rolled off the car. Yeah. He's then tried to get into another car following that. Yeah. And the male driver, with his injured wife, has punched him in the face to stop him from getting inside the car.
Right.
I mean, this story, you really couldn't script. It's just one of those out-of-the-box sort of jobs, and you really can't believe what you're hearing, but you also need to trust what the witnesses have told you. Okay. If you want to start like a upper body secondary survey and just note any injuries or abrasions or anything you can find, mate.
After such out-of-control behaviour, the patient could have serious injuries. So Mark is doing a thorough check.
A slight hematoma here on his forehead.
Okay. So got a lot of bruising, swelling, abrasions on the knees. His long bones look intact, which is good. There's sort of no obvious evidence of a pelvic fracture. Tummy looks flat, lots of abrasions and things. Arms look okay. So really not much to report in terms of injuries.
No. This patient is going to have a range of tests performed at hospital, but from what I can see, it appears that he's come away remarkably unscathed, which is incredible.
With a police escort on board, the team can now make their way to the Alfred Hospital.
Jeff, and I'm right to go, mate. Oop. You're in the back of an ambulance, mate. Just relax.
Whether this patient's aggressive outburst has been caused by drugs is still to be confirmed.
Just relax, mate.
But all emergency services are getting used to dealing with the results of the drug known as ice.
So how often, Jack, as a police officer, are you out dealing with patients that are affected by methamphetamine?
Every week.
Yep, yeah. And it seems to have permeated, you know, inner suburbia, outer suburbia, country Victoria. It's sort of...
It's everywhere.
Yeah, it is. Just a young buck. His whole life ahead of him.
As a paramedic, it's not my job to cast judgment on people's circumstances. This is a sad case, though, of a young man who's obviously found himself in a bit of trouble. I really hope that he can work through his problems and he can turn his life around.
Brucey! Hey!
Oh, you want to kiss
Kisses!
It's the start of a new shift, and this week, Leonard and Amanda have been partnered up for the first time together. These two are dog lovers, and they can't get enough of their special visitor.
Bruce, AV's newest recruit and the best looking recruit, I think, out of the bunch.
Look.
Bruce is currently on a trial as part of Ambulance Victoria's peer support program that helps paramedics cope with the stress of the job.
Pat my belly.
Yeah. He's a company man.
Isn't he?
He is so...
Bruce's job is to be by the paramedics' side to help them relax and open up about their problems.
It's pretty amazing that a family dog named Bruce can come to Ambulance Victoria and could honestly be the key to unlock that conversation between a peer support person and a paramedic who's really struggling.
Bruce, come on. Good boy. Hey.
People don't realise just how much we see. They don't realise just how much we suffer and how much we take home. And to be able to have that conversation with Bruce by your side, even just having a cuddle, can really make you feel 100%.
What does Bruce do in his downtime at home?
Well, he sleeps
Much
a
the
lot.
same.
Yeah, that's right.
Owner Ken is hoping his Labrador will be the first of many cathartic canines.
Just simply patting a dog, your blood pressure comes down, your heart rate comes down. I've seen a paramedic who just lay down on the floor next to him for about 10 minutes, holding onto him and got up and said, gee, that feels better. But these sort of things are invaluable to our paramedics.
You would brighten anyone's day, wouldn't you?
The moment I see Bruce, my heart melts and I'm just happy. And I think no matter how hard of a day you've had, how bad of a job you've just done, it just makes you feel good.
Can we take him home? Can we take him in the truck?
Hi, Special.
You can sit up front on the ambulance.
But sadly for Amanda and Leonard, Bruce is required to spread the love elsewhere, while they need to get back to work.
Okay, Leonard, we have been dispatched to a female who's had a skateboarding accident.
Their first case together is an interesting one.
Query dislocated hip.
Okay.
That could be quite painful.
Yeah, very painful. 33-year-old female.
Yeah, so you would assume that she'd be fairly fit, bones would be in good tact, so to have dislocated a hip, that's pretty good impact, isn't it?
Skateboarding at the best of times is pretty risky, and you will ask any skateboarder out there, they've done numerous amounts of bones.
Hi, my name's Amanda. I've got Leonard with me.
Hello.
Who have we got on the ground here?
Lisa, her husband Aurelian, and their 2-year-old daughter Chloe are on holidays from Malaysia.
What's happened?
She was boarding and she fell straight on the hip.
On which hip, sorry?
That one.
That one, okay.
It's all numb.
This was Lisa's very first attempt at skateboarding. She was trying to learn how to balance in preparation for surfing lessons later that week.
My wife never tried skateboarding before, and she tried a couple of times, and yeah, she got a good feeling and a big smile on her face. And then she said, oh, one more time, one more time. So she went down the hill, and yeah, I just saw her body like flip upside down. And she tells me, I cannot feel my leg, I cannot feel my leg.
When you fell, did you feel like a crack?
Yeah.
You felt a crack. Where did you feel that crack?
In my hip.
Yeah, okay. Did you hear a noise?
Yeah.
You did.
Lisa's leg is just not right. It looks completely deformed, lots of swelling, and I'm thinking, this is serious. The level of pain that Lisa is in is telling me that she's either got a hip dislocation or, even worse, a fracture of her thigh bone.
What type of pain does it feel like? Is it like a stab or is it like a really intense, sharp pain? Right, okay.
You would expect damage to a hip like that from something like being hit by a car or some type of force. But in this situation, Lisa was just rolling down a hill and was unlucky enough to dive off the skateboard and just land on the wrong bone.
Can you wriggle your toes for me? That's it. Can you feel me do that? You can.
I feel, yeah, really scared and worried and quite panic. And I just worry, is she cannot move at all? Is she gonna be okay?
Code 1 to a car accident.
Is anyone going to stop?
Sounds like it's a 2-vehicle car accident and there's a female trapped. Looks like police and fireys are all attending to, which is awesome.
Jamie and Nat are fighting the morning peak hour to get to a 2-car collision.
You clear that.
Oh, wow, it is a fairly big scene, actually.
Yeah.
This is also their first shift together, and it's looking like a challenging start to the day.
So when we get dispatched to a patient who's still trapped in a car, it adds a whole new level of difficulty for the job. We now have to start thinking about who we need to help extricate the patient, whether we need more resources to transport the patient. How you going? Good.
She's a bit anxious, a bit upset.
Yeah, of course. Yeah. Do we know her name?
Rachel.
Rachel. G'day, Rachel. How you going? My name's Jamie.
At the scene, Jamie and Nat find a very distressed Rachel in the driver's seat.
Have you got any pain anywhere at the moment, Rachel? Your stomach and your face, yeah, from the airbags. I'm just gonna have a bit of a feel around your neck. Is there any pain there at the moment? No? No pain while I'm pushing down there? No? How about going down your back there? No pain at all? Very good.
The 2 occupants of the other car involved in the accident have luckily emerged unscathed.
I'm okay. I was just a bit shaky at first because it was a shock. You don't really know what's happening, but no, I'm okay. I haven't had an accident. I've never been involved in an accident before. I hope she's okay. She didn't have like any blood or like a broken nose or whatever, so hopefully she'll be okay. Because it's only a car, isn't it?
Hi, Rachel, I'm
She's
Natalie.
complaining of a bit of stomach pain, but otherwise no other pain.
Pelvis is okay?
Pelvis is okay.
You were wearing a seatbelt, weren't you?
Yeah. Yeah, where the
Where the
seatbelt
seatbelt was?
Yeah.
Okay, it's
Yeah.
across the stomach there?
Yeah.
No worries at all. Okay.
When you come to a sudden stop with your seatbelt on, we often see a lot of bruising and swelling from where the seatbelt was. That could be what's causing Rachel's stomach pain, but we just don't know. It could be a lot worse. We can't rule out internal injuries. You right, Rachel?
There's quite a bit of shortening if you have a look where I am.
Yeah, it doesn't look right at all. Even with the strange position that she's in, it just looks like way out.
Malaysian tourist Lisa is unable to move after she took a tumble off a skateboard, landing on her hip. For Lisa's husband Aurelian, It's hard to believe that their family fun day in the park has ended in disaster.
So she's either fractured the top part of her leg bone or she's popped out her hip bone. At this point, it's kind of difficult for us to be able to tell, obviously without scanning, but she's done something and we're definitely going to have to take her up to the hospital.
So I guess the bad news would be the fracture and the pop-up will be kind of better news.
A dislocated hip is probably the lesser of two evils, yeah, but we're not sure.
Breaking a bone like your thigh bone can be pretty serious. Worst case scenario is she starts bleeding internally, so we really need to get her to the hospital quickly.
We're going to put a little needle in your arm, okay, Lisa? Little sting. We're going to give you a drug called fentanyl. It's very similar to morphine, and it might make you feel a little bit woozy, but that's what it's supposed to do, okay?
With Lisa's pain under control, Amanda and Leonard can now move her into the ambulance. But it's a delicate operation, so Matt, the team manager, is helping out.
All right, so Lisa, what we're gonna do, we're gonna get you to roll back, just onto your back. Are you ready? Okay. It's gonna hurt.
Yeah. Don't be scared, it's okay. And if it hurts too much, we'll stop and we'll give you something else, okay?
So we're about to put Lisa onto our evacuation mat when out of the corner of my eye, I see this grey dog start running towards us.
Once this BP reads or doesn't read.
And I think to myself, that dog's gonna stop. The owner's gonna stop that dog. And it gets closer and closer.
And I'm thinking, no, don't you dare.
You right, Rachel? You okay?
27-year-old Rachel has accidentally driven into the back of a car.
How bad's that pain at the moment, Rachel? 4 out of 10?
Jamie's main concern now is whether his young patient has suffered any internal injuries.
The adrenaline's usually really high after a car accident and it masks the pain, so we have to do a real thorough assessment to make sure that there's nothing that they can't feel and that we can't see. Not complaining of any neck pain, back pain, anything like that. Just complaining of abdo pain from where the seatbelt was, which she says has come down to about a 4 out of 10 now, which is good. I'll just do a quick set of vitals.
Distraught Rachel is worried about everyone else involved in the accident.
Not hurt anyone else.
I haven't seen anyone else. I don't think anyone else is...
People in the other car are fine. I've spoken to them and they're doing really well. They're just concerned about you, all right?
Jamie and attending Micah paramedic Peter are doing their best to reassure Rachel and calm her down.
You just focus on your breathing, okay, Rachel? Just try and relax a little bit.
A remorseful Rachel has told the ambulance officers she took her eyes off the road for just a moment to look at a map on her phone and rear-ended the other car.
Sorry. No, you don't need to apologise for anything.
I'm just sorry. They call them accidents for a reason. No one means for these to happen.
You all right?
In a bizarre twist, a runaway dog has just jumped on holiday maker Lisa's badly damaged leg, the result of an ill-fated skateboarding attempt.
You know, we deal with unpredictable scenes every day, but I have to say, having a dog jump straight on a broken leg has got to be one of the most extraordinary things I've ever seen. Poor Lisa.
As the furry culprit is led away, Amanda and Leonard begin the tricky process of moving Lisa onto the stretcher.
So you lean back when you can, I'm supporting you. It's going to be a little bit painful, okay? But if it's too much, you let me know. That's it, onto your back. Onto your back, straight, flat on your back, it'd be great.
When we initially moved Lisa, she was in a lot of pain. We gave her a little bit more analgesia and we just made sure that we did all of the movements we needed to do. They were concise, fast, and effective.
You're doing well, Lisa. I know you're in a lot of pain. We're going to give you something else.
Yeah, give her another dose of fentanyl.
All right, I'm going to go the other 50.
It is really hard to see my wife in pain. I'm almost crying, to be honest, at that time. She keeps saying, I'm sorry, because she realized how bad the situation is.
On go?
On go.
Ready, set, go.
And we'll just go a little bit at a time.
Meanwhile, Rachel's rough start to the day isn't getting any better. After accidentally crashing into a car, the 27-year-old is now reacting to the chemicals released when her airbag went off.
Do you feel like you're going to be sick, Rachel? Or is it just the coughing?
Every time Rachel coughs, I do feel quite bad for her because she's grimacing in pain, which we see quite commonly when airbags are deployed.
Hello, Rachel. I'm Joe from the Highway Patrol. You okay?
And to add to Rachel's worries, Senior Constable Joe has arrived for an obligatory alcohol breath test.
Draw and one breath out. Go, that's it. Well done.
You all right? Your face? Yeah.
The test is all clear, but Rachel is still shattered.
I was looking down, I just wasn't looking at the road.
Okay. So you just weren't paying attention. That's okay. That's all right. You don't have to be upset. Like, worst case scenario was injured in jail for 20 years, all right?
Brilliant.
No. So don't stress it, all right?
While outside the wreckage is being cleared, inside, Jamie's discovering his patient is no stranger to the back of an ambulance.
You're a nurse. Do you work in the emergency department or?
Bagging?
No.
I have.
You have?
I have my paramedic degree.
Oh, do you? There you go.
What is she?
She has her paramedic degree
Oh
as
my
well.
goodness, you could treat yourself.
I tried it once, it wasn't.
All good to go, Jamie? Excellent, okay.
Fortunately, the scene of the accident is only a kilometre away from the Austin hospital.
Okay, I'm gonna head off slowly.
Yeah, no dramas.
Jamie is giving his patient more pain relief for the short trip.
Just one more spray up the nose, okay? 1, 2, 3. There we go. Hopefully that'll get on top of the pain, okay?
A lot of the car accidents that we go to are because people are using their phones. Some of the worst ones that I've seen have caused fatalities.
So we're just pulling up now.
All it takes is a couple of seconds and it's just not worth it because knowing that you've injured or hurt somebody, I'm pretty sure you'd be living with that for life.
It's different being on the other side, isn't it? Yeah, I guess you're getting first-hand experience of being a patient.
It's not as fun.
Not as fun, is it? No. I must agree with that.
Rachel will soon find out if she suffered any internal injuries.
At least it was just around the corner from hospital and you weren't stuck with me for too long.
All of me.
Hopefully, the young nurse will be able to get back to her job, saving lives, as soon as possible.
Love your work, Jamie.
Thank you.
Ready, set, go. Doing well, Lisa.
Doing a really good job, Lisa.
Young mum Lisa and her family are still coming to terms with the frightening results of her skateboarding disaster.
That's it. That's it.
You're doing
You're
really
on the stretcher.
well.
I think a lot of people underestimate the complications that can actually happen when you break a bone. People think, oh, it's just a bone, it's just a bit of pain. But, you know, large bones are right next to large blood vessels. So when you break a bone, they could actually penetrate the blood vessel, causing internal bleeding that we can't see. So it can be very, very serious.
Amanda and Leonard are now transferring the unlucky tourist to the Alfred Hospital for x-rays.
How long have you been skateboarding for?
No, I just started today.
Never again, huh? Yeah. Oh, that's so unfortunate that you have done this.
We actually leave yesterday, but it seems like these 2 weeks quite good weather.
Yeah.
So we decided to change the ticket and extend 2 more weeks.
Well, to be honest, I think you might need to extend it a little bit more.
Really?
I think so.
Oh my God.
I can't imagine that Lisa and Aurelian ever thought that their dream holiday would turn into a total nightmare.
So last blood pressure was 134 on 75, heart rate of 80,
Great.
just a bit of like a contraction-y sort of spasmodic pain.
Yep. I really hope that things are going to be okay and that she can recover quickly.
Lisa is now being taken to the trauma centre, where doctors will decide if she requires surgery for her shattered leg.
Doing well, Lisa? Poor lady, fell off the skateboard, and then all of a sudden, you see that dog? Comes running around, and where does he jump?
Right in
on the
leg. It's Murphy's Law, isn't it? But I can tell you right now, she won't be getting on a skateboard ever again.
No. No, there's definitely some physical scars and a bit of mental scars from skateboarding after today.
How an overseas trip can go wrong.
Yep.
Let's go home.
It's been 3 weeks since Malaysian tourist Lisa had a disastrous skateboarding accident. She's still in Australia with her husband Aurelian and daughter Chloe, and she's still in a wheelchair. When Lisa crashed off her skateboard, she was in excruciating pain. At the hospital, tests revealed a nasty fracture of her upper thigh bone. Doctors had to insert a metal rod to repair the break.
Where's the hand? Yeah, okay.
It'll be weeks before Lisa can walk again and the family can finally return home.
I don't think I want to skateboard anymore. Yeah, I'm too afraid now.
But despite this holiday nightmare, Lisa says she's still considering another trip down under.
Coming to Australia is my dream because so many things to explore. So I do wish to come back again. Good job. Done, done, done.
Yeah, we love this country, so for sure we can be coming back.
As for Rachel, the good news is she didn't suffer any internal injuries after accidentally running into the back of another car. The 27-year-old nurse did suffer severe bruising to her stomach and needed 2 weeks off work. 10 weeks ago, a tree fell on Rob and smashed his ankle during a four-wheel driving trip with his wife Trudy in Victoria's remote alpine country. The farmer was emergency airlifted off the mountain, while Trudy managed to drive their vehicle out of the difficult terrain and join her husband in hospital. Surgery was needed to repair his broken fibula, and screws were inserted into his ankle.
Not very hungry today, girls. Too much food.
Fortunately, after intensive rehab, Rob is now back working on his property.
Come on. Considering we haven't had too much rain, you don't look too bad, girls.
Look at you, big fella.
There you go.
How you doing? More to the point.
Going right.
Good to see you walking.
Yeah, going good.
Going good?
And today, Ray, the flight paramedic who helped rescue him, has dropped by to check on his patient's progress.
Come inside.
Come in.
He was as white as a sheet and I was hoping he didn't pass out. And once you guys landed, it was like, my job's over. Look after him.
No, you did all the hard work, not us. Don't worry about that.
You know, I get a bit emotional about it sometimes, but it's amazing that people will come like you and do their job to help somebody else out.
Rob and Trudy both extremely grateful. And, you know, that's quite heartwarming for us. We don't do it for the thanks or the kudos. We just do it because that's what we love doing. We love helping people.
Life-changing, to be honest.
Thank you very kindly on behalf of all of us.
Yeah, I really appreciate it. Every time I see a red helicopter, I'll think about them. Not just Ray, the whole lot of them are just amazing blokes. And, like, yeah, can't thank them enough. But